Anemia in children is a common yet often overlooked condition that have serious consequences on their development and overall well-being. As AWANI Tonight speaks to UM's Professor Dr. Muhammad Yazid Jamaludin to find out more about the risks of iron deficiency anemia in growing kids.
Now, 1 in 3 children in Malaysia are at risk of anemia, with low iron being the main cause of it. Now, I'm at the IWK Eco Park in Pantai Dalam for the launch of Danone and the Women, Family and Community Development Ministry with our guests for today, Professor Dr. Muhammad Yazid Jamaludin, Professor and Senior Consultant Pediatric Endocrinologist from Universiti Malaya. Now, I want to explore a little bit more about iron deficiency in children. Now, many children with iron deficiency don't show symptoms. What are the health risks for this group of children?
Okay, so 90% of children who have anemia do not have symptoms, and because the problem with symptoms is that you will only notice the symptom when hemoglobin is below 70, and because of that you have an issue of dose between 70 to 120. Okay, these are patients with children with anemia but no symptoms. The issue here is that even if they have no symptoms, their brain development is already affected. Because as we know, iron is very important for the production of the red blood cells. And if you don't have enough red blood cells, which is hemoglobin, you cannot carry good amount of oxygen to your brain, where your brain needs to develop. And because of that, the brain development is poor, the complexity of the brain development is affected, and hence, in the long run, IQ can be affected. That's on one part to the brain development. The other things that we have to look into is also the issues with stunting. Because again, we need hemoglobin, we need the red blood cells to bring all the nutrients to all our organs, the heart, the liver, even the bones, for them to grow tall. And if you don't have enough hemoglobin, the children will not grow tall as like other kids. And because of that, they will have stunting. And the third thing that is important is immune system. So if you do not have enough hemoglobin, your immune system do not develop as well. And because of that, they can have more infections, and this will continue to cause them to have recurrent infection. And we know children can easily get infection because there's so many of them in one, kindergarten or even taska. So because of that low immune system, they continue to have repeated infection.
In order to tackle this silent epidemic, Professor Dr. Muhammad Yazid urges for a united and coordinated effort among the stakeholders. This includes a non-invasive nationwide screening program for anemia.
We need to screen. And when we talk about screening, we have to screen early. And that's why in our guidelines, we advocate to screen all children between 9 months to 12 months. Start the screening and then yearly screening up to 5 years. How and why we actually advocate for that is because now we have new machines, new technique that you can do non-invasive screening. I understand parents are very scared when we talk about screening where we need to take blood from your child. No parents would want their child who do not have symptoms to have their finger prick or heel prick, to get the blood done, to screen for anemia. But now we have the non-invasive screening, which takes you only 30 seconds to get the result. So I think if we were to do this kind of screening, mass screening throughout Malaysia, not just for children, I would say, using the non-invasive method is the way to go, because we understand even young girls, young women going into pregnancy have issues with anemia. If the mother has anemia problem during pregnancy, that will also cause problem to the fetal growth, and that will cause small gestational age children being born.